Hi, my name is Andrew Preventure. I'm a principal of Be Fresh Consulting and helping to coordinate a coalition of groups that have helped put together this ad hoc commission on climate emissions. We're going to start the first half of our meeting here. It'll be 3 presentations that have been pre-recorded. Those presentations will play back to back. At the end of that time, right around 7 p.m., we'll begin our official commission meeting and do our introductions and things of that nature. I'm going to have Sheila start our presentations. If panelists would be able to turn the video portion of their screen off for the presentations, it'd be very helpful just with bandwidth. Thank you so much, and we'll see you in just a bit.
Hello, everyone. I'm Semra Aitor, and I'm an epidemiologist and an associate professor in the Department of Health Management and Policy at UNH. And thank you for inviting me to speak with you about climate change and public health. I'm hoping that this presentation will be informative for you, and we'll try to keep it relatively brief, even though there's a lot to cover here. I apologize, I'm going to keep my screen in this mode rather than full screen because it was getting stuck on me during an earlier presentation and I need to be able to advance my slides by clicking on them. So apologies for the lack of a full screen presentation, but we'll do the best we can here. So I want to emphasize a few key points that I would like to make for takeaways for this presentation. I'm going to be talking about the public health impacts of climate change in New Hampshire, and much of this work is drawn from a report that I published with colleagues, Dr. Cameron Wake and Dr. John Bucci in 2014, and you can access the report at the link below, which I'd encourage you to do if you have interest, especially in particular details about any of the topics that I'll be introducing today, since I will really have to kind of skim the surface and hit the high notes. But this report does include a lot of details about the methodology, and it goes into more depth on each of the public health impacts that I'll be introducing to you today. I'm also going to talk about how vulnerable populations may be differentially impacted. And I'm going to identify some intersections between climate change and the SARS-CoV-2 or COVID-19 pandemic, since I think often these are not talked about in an integrated manner in the media, and there's some really important connections that we should think about recognizing here. And I'll try to use maps and prior research, especially toward the end of the presentation, to illustrate these impacts. I also have provided a lot of references throughout, so you're welcome to refer to any of these research studies on your own for further detail, or just email me. I can share with you. So to kick us off here, I'm going to start with perhaps the most important message, which is climate change is impacting public health now, and will continue to do so probably even more severely in the future. So these are important concepts because those of us working in public health have known that climate change has been impacting people for quite some time now. This isn't a future thing any longer. And I know that decision makers must balance multiple needs and priorities. I've given similar talks to all the way from mayors up to our congregation in Washington, D.C. So I know that people are juggling a lot. There's a pandemic on. Decision makers have to think about everything from health to the economy to the environment and equity considerations. So there are many, many different things that I know are creating multiple challenges, particularly at this time. The ones that I'm going to discuss in terms of public health impacts that are probably most relevant to New Hampshire are the ones listed here: heat effects, sea level rise, more frequent storms and flooding. And then I will talk a little about vector-borne disease and food and waterborne, just because those are also important, but I won't have time to go into the many, many different health impacts, especially some like wildfires that really aren't as prevalent for us here in the Northeast yet, although they certainly affect other parts of the country. The other thing I wanted to mention here is that these challenges also bring opportunities for us to consider the co-benefits of planning in more sustainable ways, and for really thinking about ways in which some public policy decisions might benefit both people and the environment and the economy. They're not always in opposition to each other. So one of the things we really try to do in public health is start encouraging people to think about co-benefits. So how is climate changing in New Hampshire? Well, New Hampshire has been getting warmer and wetter over the last century. And this is probably the most important message from the report that Dr. Cameron Wake really led in terms of the climate impacts that you're seeing here. We know that the rate of change in terms of temperature, for example, rising temperature has increased over the last 4 decades. Since 1970, for example, the annual maximum temperature has warmed from 0.5 to 2.6 degrees, and the greatest warming occurs in the fall or winter. The number of days with minimum temperatures less than 32 degrees Fahrenheit has decreased, and the coldest winter nights have warmed. Annual precipitation has increased by 7 to 20%, and extreme precipitation events really have increased across the region. We've probably seen, if not witnessed ourselves, the large flooding events that have impacted our coastal communities in New Hampshire. And I do have some research that I conducted with colleagues that is referenced more specifically to the Hampton-Seabrook area, where you can really get a much closer and more granular look at what those impacts look like, both from a human health and environmental and economic perspective. So I'd encourage you to look at that, and I'll show you the reference in clearer detail in a moment. But let's kind of talk about a little more what is happening in our climate and health report, where we really did a number of things to generate future climate projections. What our team did is simulated temperature and precipitation from 4 global climate models, which were statistically downscaled using historical weather observations. And there really were 2 emission scenarios that we focused on for this report. Again, Dr. Wake's team really led this work, and we accounted for a range of potential fossil fuel use by utilizing these 2 scenarios, which you can, to make it simple, think of as a lower emission scenario and a higher emission scenario. In the lower emission scenario, improvements in energy efficiency were combined with the development of renewable energy to reduce global emissions of heat-trapping gases below 1990 levels by the end of the 21st century. And in the higher emission scenario, fossil fuels are assumed to remain the primary energy source, and emissions of heat-trapping gases grow to approximately 3 times those of emissions in the year 2000 by the end of the century. So those are the parameters of those 2 scenarios, and you'll see them reflected visually in another couple of slides. So just kind of keep those in mind. What we know is the current global emissions trend from 2000 through 2014 suggests that in the absence of concerted efforts to reduce emissions, climate change will likely track or exceed the scenario projected under the higher emission scenario over the course of the century. As heat-trapping gases continue to accumulate in the atmosphere, temperatures will rise in New Hampshire. So let's take a look at what that would look like from a graphical perspective. And in the report, you'll see that we did this with 2 separate graphs, one for northern New Hampshire and one for southern New Hampshire. I'm showing you the northern New Hampshire panel here. And what you can see is that there are increases in temperatures from 1960 in this case, going forward to 2100. And where the emission scenarios really start to depart, with the higher emission scenario depicted in red and the lower emission scenario depicted in blue, is right around the year 2040, maybe a little bit before that. So that's where we can really see, depending on our actions, this potential split in terms of what our temperatures might be going forward to 2100. And the 2 panels on the left, it's showing you the average maximum temperature, on the right, the average minimum. So what does this mean in terms of more of a contextual view? The frequency of extreme heat days is projected to increase dramatically, and the hottest days will be hotter, raising concerns regarding the impact of extreme heat on human health, infrastructure, and the electric grid. As a result of an increase in heat-trapping gases in the atmosphere, temperatures across New Hampshire will continue to rise regardless of whether we follow the high or low emission scenario. However, the magnitude of warming, where you saw that split occur between the red and the blue lines, really can be expected to depend on the emissions pathway that's followed. We can influence how much warmer things do or do not become potentially. And we also looked at precipitation. So average precipitation is projected to increase 14 to 20% by the end of the century compared to the historical average. So you'll see a lot of graphs and statistics about precipitation in the report as well. I just wanted to draw your attention not to the detail here, so no one has to focus on fine print, but if you are interested in putting some actual numbers to the graphs that I just showed, there is a table here, table 1 in our report, which really breaks this into short-term, medium-term, and long-term projections using the low emissions and the high emissions scenario side by side for each of those phases, short, medium, and long. And you can look at either a minimum temperature, max temp, extreme temperature days per week. So this will really provide a lot of the detail if you're concerned about this topic that you can refer to directly from our report. What does this mean for public health? Well, the projected increase in the frequency of hot days and associated increases in heat stress will likely lead to more heat injuries and deaths. We know that mortality rates are correlated with the number of days where maximum temperature is greater than 95. And actually, since we did this report in 2014, a really good scientific peer-reviewed paper has come out, which was published by Dr. Kathleen Bush at DHHS and colleagues at Brown University, Dr. Greg Willanius, and other colleagues, where they really showed that actually it's 85 degrees Fahrenheit that is the trigger of concern within the range of concern, and where serious health impacts really can start to accrue with 85 degrees Fahrenheit and higher. Their work is a very detailed and statistically sophisticated account of that, and they have since, I think, been able to work on revising heat warnings in light of those findings. I have cited that later in the presentation, so please try to read that if you're interested in this. It's really, really good work. We also know that death and injury due to extreme weather events can lead to morbidity and mortality associated with flooding, storms, and exposure to contaminants that can be left behind in the wake of storms, for example, mold and other contaminants, where even when the floodwater recedes, these things can remain in homes and dwellings for quite some time. That can exacerbate pre-existing conditions such as asthma or other pre-existing health conditions people might have. And of course, I think the one thing maybe we are now more conscious of than ever before is that when there is such a disruption in our lives due to the pandemic currently, or it could be a flood or a climate-related disruption, we really find that it can become very, very difficult to obtain the basic things we need to keep ourselves healthy. That might be medications, access to food, access to health services, keeping our home safe. All of those things, let alone keeping our businesses and our livelihoods afloat, can really be simultaneously impacted. And I think perhaps there's a greater understanding now at the population-wide level of what that can feel like due to the COVID-19 pandemic. We also know that additional indirect health impacts are associated with extreme weather events, and these can include degradation of water quality and increases in emerging diseases, new pathogens, which can also affect contaminated seafood. And we have longstanding issues with things like harmful algal blooms, for example, which can increase with higher water temperatures. And those can have significant public health impacts as well. In Toledo, for example, it actually affected the public water supply due to a harmful algal bloom. There, we have not had that level of impact here, but we do have blooms, as they do in Vermont and in surrounding states. So these things are occurring, and they are things that we need to keep watching and monitoring. So this figure from the IPCC really does a nice job of showing what we call direct and indirect health impacts. And that's just an important concept to convey in a talk about climate change and public health, because both are really very important, both direct and indirect, but often the media attention goes to the direct impacts, which include things like deaths due to a wildfire or direct injuries due to a flood, for example, um, maybe some emergencies due to a severe heat event. And those things, no doubt, are very, very important. But we also know that the indirect exposures and the indirect impacts, which can accrue from climate change, can also be much longer lasting, and in some cases actually carry greater greater costs and economic impacts as well. So I have another slide, I think it's this next one here, that again, if you go back to our report and look at table ES3, there's a summary of the potential health impacts, sorry for the missing S there, associated with climate change. And these are, you won't have to read all the fine print here, but what we tried to do to organize this table for you, and there are many more that could even be listed on one page, is we took each climate and health indicator, for example, heat stress, that could be measured by the increase in the number of hot days. For example, we now know hot is 85 or higher. And then we look at primary and secondary health impacts, which kind of mirror the language in the prior slide, which was direct and indirect. So if we think about for heat stress, primary impacts would be increase in heat-related illness and death. We probably see those in hospitalizations or death statistics. But then there are really significant secondary or less direct impacts, which could include increases in cardiovascular impacts. For example, we know that people with underlying cardiovascular disease can have increased symptomatology during a heat event. We also know that violence increases during heat events, and suicide can also increase. And then if we look at the last column, this is the column where we really try to point out some of the equity considerations and the differential vulnerability. So for example, with heat stress, people who live in urban areas with little green space and might experience what we call a heat island effect, where there might be a lot of pavement or impervious surface that really just acts like a convection oven radiating heat, very little green space to buffer that often. And it's really frequently our lower income neighborhoods or communities of color where there isn't enough green space and these heat island effects are clustered. And that temperatures there can sometimes vary by, I've seen as much as 8 to 10 degrees, so it can be significant. The other thing to keep in mind are people who might have jobs that require them to work outside in hot conditions. So for the heat stress indicator, those are the kinds of folks with certain occupations that we would really want to consider in terms of the differential impact of them. So if you kind of, take each one depending on which health indicator you are really interested in, this table will take you through that process of thinking through each one. And again, you can refer to that from the report. So let's talk a little about foodborne illness. Foodborne illness is expected to increase as a result of extreme weather events. With climate change, the CDC estimates that approximately 16% of Americans become ill and 3,000 die of foodborne illness every year. And in New Hampshire, with those increases in temperature and precipitation, what that might mean from a food safety perspective is with increased power outages, that can disrupt refrigeration, there can be more food spoilage, and impacts to fisheries and other food economies associated with pathogenic organisms, for example. The other thing that we've been increasingly conscious about, again, with respect to the COVID-19 pandemic, is there are significant issues with food security, especially in certain parts of our state. Here I'm citing research from Jessica Carson at the Carsey Institute, and there are a number of Carsey reports that you can access to read much more about this issue. We know, for example, that much of northern and western New Hampshire has a higher proportion of lower income residents and low population density, which can result in less access because there are fewer full-service supermarkets and other places where you can buy food. And that's really shown in the map here, where without even reading the fine print, if you just look at the density of the colored dots, which represent different kinds of food service outlets or places to buy food, they're really concentrated in the southern part of the state and can get pretty sparse up in the northern part. So when there are disruptions to our food system, either due to a pandemic or due to climate change, there can be real exacerbation in existing food insecurity. So vector-borne disease, I'm not an expert in vector-borne disease. There are people who specialize in that as their whole career. And so I'm just going to hit the high notes here, but we know that vector-borne disease incidence in New Hampshire has increased in the past decade, and the projected increase in temperature and precipitation may create conditions conducive to further increases over time. The next slide, I think, which has some maps for you, really illustrates that. Sorry, I'm getting the afternoon sun here. So for example, Lyme disease. Here we see the incidence of Lyme disease from 2001 moving forward to 2018. And you can really just look at the dark blue dots and how much more of them there are as you move to 2013 and then pretty much persisting. So increases in Lyme disease is definitely something we've seen in the public health community. And waterborne disease. So waterborne illness caused by microbial organisms may increase as a result of an increase in extreme weather events associated with climate change. This again can be related to both water temperature and precipitation frequency and severity, which can all result in, for example, increases in harmful pathogens, resulting in increased human exposure, for example, cryptosporidium, other types of pathogens. And often people can become exposed to these if they're swimming or immersed in water and they get water up their nose or accidentally down, swallow a little bit. That can be enough to expose them, as well as sometimes, like I mentioned, with the harmful algal blooms, occasionally those can even impact drinking water supplies. They have not in our state, but in Ohio, that was a serious concern. The other one that I really want to mention is the implications for mental health and stress-related disorders. Poor mental health is associated with climate change and severe weather events. And I often refer to this as the hidden shadow or the long shadow of climate-related kinds of impacts, whether those are, for example, from flooding or hurricanes, especially any kind of thing where people are displaced for a longer time from their home. That can really carry very long-term mental health implications. And you know that from Hurricane Katrina. There's been quite a lot of research there showing that as long as 10 years after, significant proportions of the population is still dealing with stress and mental health issues. And of course, then if we think of things like COVID-19 and perhaps the convergence with pandemic events, there is really a very clear need to focus on our mental health systems and our capacity there. So there's a couple of points I want to make again about intersections between climate change and COVID-19. And really there are two key points here. One is that climate change can play a role in increasing our risk of future pandemics. And the reason for that is, as on a global level, the planet warms, animals are forced into closer contact with human beings, sharing much of the same space with human beings where they used to be able to be more distanced. And as a result of that, our increases in zoonotic disease, which means spreading from a pathogen, spreading from an animal to a person, as was the case with this virus. And most of the emerging pandemics, we now know at least 2/3 of them are coming from a zoonotic origin. So whenever you have this sort of more permeable membrane between animals and humans, there's going to be increased risk of zoonotic transmission. And many of our current emerging pandemics start that way. Climate change can also play a key role in exacerbating the impact of pandemics. And a recent study out of Harvard, for example, suggests that people who live in places with poor air quality are more likely to die from COVID-19, even when accounting for other factors that may influence death. So again, this really shows that where you live and climate change can differentially affect the built and natural environment of the places where people live, and that can lead to further health disparities, which we've definitely observed with COVID as well. How does climate change affect healthcare costs? Well, we spend just over $3 trillion per year in the United States on healthcare, and research suggests that approximately 50% of those deaths in the United States are potentially preventable, largely by influencing, for example, pollution, diet, exercise, and other lifestyle habits. And there's a study from the EPA that was conducted in 2011 that assessed the return on investment, showing that the benefits, for example, if you look at the costs related to the benefits, they were able to determine that the benefits of the Clean Air Act for every dollar invested reduce air pollution and give a return on investment of approximately $30. So 30 to 1 is the return on investment there for having clean air. So I think with that, I am going to, I know I'm supposed to keep it short, and you can see that this is a topic where we could talk for a very long time. I just want to show you one more slide, which gets at the local vulnerabilities, in this case from a study that was conducted in the Hampton-Seabrook estuary. And in relation to the map that you're seeing here, what you're seeing are census tracts with their little white census tract numbers. But the takeaway message from this slide is when you look at an area at a much more specific geographic level, in this case, the census tract level, and this is the kind of a snapshot of parts of the towns of Hampton, Seabrook, and Hampton Falls, sort of this area, which is really hard to see what that is. But what we did here is we composed a social vulnerability index based on the CDC and NHDHHS guidelines, and there is documentation for how that's done. It's fairly standard in the literature. And that allows us to color the tracts according to the number of vulnerability indicators they have. So for example, this tract in red had a number of different social vulnerability indicators that paint this particular profile of that tract: 31% living in poverty, 23% having a disability, about 21% are over the age of 65. So all of these clusters of risk are co-occurring in the census tract. And then the ones that are a little more orange have fewer vulnerability flags or indicators. Those are the orange ones. And the ones that are yellow really have 0 or just 1. So those are the lower risk areas. What we did for the flooding study is we overlaid this index with, and that's the real flood example from 2018 in that area. Here's our representation of using really sophisticated hydrology modeling where the future flood impacts would hit the hardest. And so here you can see that, especially as these are projected forward in time using different storm surge scenarios with and without sea level rise. And you can read all about how we did this in our other report, which is the NOAA report led by Dr. Paul Kirshen. That's referenced, I think, on the prior slide or in my references. And you can see the flood goes right through that very highly vulnerable red census tract. So the folks who are least prepared to deal with these impacts are probably going to be among the hardest hit. Those are the kinds of things that we can draw out using, for example, health impact assessment methodologies like we used in this report. Thank you so much for allowing me to share my time with you today. Thank you.
Hello, I'm Justin Cates, Director of Emergency Management for the City of Nashua, New Hampshire. And I've been asked to talk a little bit about adaptation and emergency management. What are some of the things that emergency managers are doing today as a result of increasing storm events, heat waves, and all the other things that we deal with when it comes to climate change? So emergency management, real brief, we typically look at it from 4 phases. Mitigation, which is the reduction of risk, actions that we can take prior to an emergency to try and buy down that risk as much as possible. Preparedness, things like acquiring supplies and training and working plans to ensure that we're prepared for different types of emergencies. Response is what people mostly see when they think of emergency management. As you see on the pictures here, we might activate our emergency operations center to manage emergencies. We might activate shelters, things like that. And then recovery, that's the reconstruction, rebuilding of the community after a disaster, but also trying to get the society, the business community back to as much normal as possible. And all of that is done as part of the emergency management cycle. But one of the challenges that we deal with in emergency management is the activities that we're predominantly involved with throughout the year are only a very small subsection of the types of activities that actually make a difference when it comes to community risk. Here you'll see when we're talking about flood risk, evacuation plans are certainly something emergency management is responsible for. Risk communication to the public and ensuring that they're aware of what the risks are within the community related to flooding are all things that you'll find emergency management heavily involved with. But when it comes to zoning and flood walls and storage of flood water, building codes, those are things that might be found by other departments within the city or in the state. And those are things that emergency managers have to work closely with those stakeholders to ensure that we're looking at emergency management holistically. So what are we concerned about as emergency managers when it comes to climate change? Our primary things that, at least from an inland city, I'm concerned about more extreme rain events, so those rain events that drop lots of water in a short period of time, or more frequently drop lots of water in a short amount of time that our stormwater system is not able to keep up with. More hot days, particularly in our downtown urban core. Those houses in most cases don't have air conditioning, and so there's a lot of concerns related to heat waves and extreme heat days that impact our vulnerable populations. Certainly more wet snow events. We see those during nor'easters, typically in the October, November timeframe, where lots of heavy wet snow will be dropped, and it results in trees down, wires down, and a lot of big problems for emergency managers. And then more dry days. Drought is another concern that we have. In the city of Nashua, we're not as concerned related to the challenges with our water supply because we have two sources, both from the Merrimack River and from the Pennachuck supply ponds. But that is something that's concerning to rural emergency managers where there's a lot of reliance on wells, and that's something that certainly is a concern. But we do have a lot of great data, both at the national level and here within the state, that help to guide emergency managers on the types of actions that they can take. On the left, you'll see the Climate Explorer, which is a helpful tool for emergency managers to understand their risk related to climate change. And then certainly the reports that Dr. Cameron Wake from UNH has put together with his team on the climate impacts here within New Hampshire. So when emergency managers typically look at the impacts of events on critical infrastructure, one of the new things that we're really focusing around is lifelines. These are things that are essential to the community really relies on. And so a significant flood event might have the potential to create impacts to many of these lifelines and the components that are within them. So if we're looking at more frequent rain events that impact these, you're going to see more frequent disruptions to the necessary things that we rely on as a society. So emergency managers typically don't look so much at the hazard, but instead at the impacts and the consequences that occur due to that. So to combat that, one of the things that we did back in 2018 was we implemented a program called the Resilient Nashua Initiative. And this was an effort to update our city's hazard mitigation plan, which is a requirement by FEMA to do every 5 years. And we decided we were going to include climate adaptation and really pre-disaster recovery planning as a part of this, using this 6-step process that the National Institute of Standards and Technology put together. And throughout the process, you'll see on the left and the right-hand side here, there were a number of partners that assisted us through technical assistance and funding to go through something like this. Now, unfortunately, this is a pretty substantial effort. It's probably not likely that every community across New Hampshire would implement a similar program, but there are best practices and things that can be pulled from this and implemented within each jurisdiction across the state. So why did we look at community resilience rather than just the broad hazard mitigation approach when updating this 5-year plan? We thought, well, we're looking much beyond that 5-year planning horizon. What are the impacts that we're going to see, including changes in climate, much further than that 5 years? And what impact is that going to have on the city of Nashua? And we also wanted to look at those chronic long-term stressors rather than just single hazards that might occur, whether they be flooding or significant storm or a heat wave for a couple of days. What does the long-term impact of a very hot summer have within our community? And one of the big things that came out of this was this concept of the resilience dividend, or also known as co-benefits. When we might implement some sort of an activity within our community, like a transit system, there are multiple benefits that come along with it. So in the emergency management case, it's now an emergency capacity that we can use to evacuate people during a disaster, but it also reduces harmful emissions. It connects people to jobs. So it has a lot of great benefits to the community. And so one of the things as part of the Resilient Nashua initiative was really ensuring that we would reach out to the whole community and ensure that we had representation and involvement from all of our community organizations, city departments, to make sure that what we were recommending when it came to trying to reduce risk in the community was really accurate and needed by the community. We also had a website that we had put together to crowdsource recommendations and concerns that people saw across the community. So if they saw flooded streets in a certain part of the community, they could post that information on the map, and we'd get a better idea where there were concerns that we had to deal with in the city. As part of the Resilient Nashua initiative, we did a pretty substantial risk assessment, and we found that a lot of the critical infrastructure that we had talked about, those lifelines, were at risk. And here's our wastewater plant, certainly at risk for flooding. And this is something that's much more concerning to us now, because not only is it at risk for riverine flooding, but in the downtown urban core, where you've got combined sewer systems. That means those areas where stormwater goes into the general sewer system. In most cases, those aren't designed to deal with significant rain events beyond your normal routine storm. And so when we have these extreme rain events, the systems are overloaded, and in most cases, you start seeing flooding and ponding on roadways, which is unfortunately a situation where you've got combined sewage also involved in that. So this is a major concern for emergency managers when we look at consequence management. But it's not just critical infrastructure when we look at the bridges and the important buildings that we have within the city that government owns. We also look at the economy. And so as part of the risk assessment, we looked at flooding and what types of census blocks would see the most significant economic losses during major flood events. And you'll see here, it's obviously around the areas where the rivers are, but there are some really interesting things that you can look at here to see where there are some vulnerable locations due to flooding. And one specific example here is the area off of Daniel Webster Highway in Nashua, where right along the Merrimack River, we have quite a bit of economic drivers within our city and our region as well. So, looking here, you'll find that the Pheasant Lane Mall is within that what we would call the 0.2% recurrence interval flood event, so also known as the 500-year flood event. And this is something that not only has happened in Nashua before, we have seen the 500-year flood event, but it also is a situation where this is likely to happen much more frequently in the future if we start to see more significant rain events. So definitely something that concerned us and concerned our stakeholders when we looked at flooding across the city of Nashua. So as part of the Resilient Nashua initiative, one of the things that we did was we looked at the infrastructure within the community and identified when we wanted those things back up and running during a crisis. And then in order for us to get those things back up and running, what would need to be done? And what were the expectations of recovery from those critical infrastructure owners? So as an example, here on the left-hand side, you'll see hospitals, fire stations, the police station. And based on a scenario that was run by a software program called HAZUS, it looked at a significant flood event and it identified what would be the functionality of that property after the flood event. So we would then be able to use that to determine on the right-hand side here, we want our public safety facilities open one day after a major flood event. But the software hazard scenario is actually saying that we're not going to have those facilities back open until 4 weeks afterwards. So how do we reduce that gap? By mitigation measures, preparedness, trying to get those facilities back up and running. And as part of our Resilient Nashua initiative, we had to identify those mitigation actions that our community could take to go and try and reduce that risk. So historically, we've looked at things like, replacing bridges so that they allow more water to flow through, or culverts to allow more water to flow through, hardening our electrical infrastructure. But now there's an approach that we're looking at when it looks at trying to use green infrastructure as a way to reduce hazard risk within a community. And so there's a lot of great resources to use when you're looking at putting together a mitigation plan. And these are things that we might look at within the city as we try to reduce risk. We also use a process called the Resilience Dialogues, where over a period of a month, we worked with academia and subject matter experts from around the country to take lessons learned and best practices from other cities that are the size and style of Nashua, so that we could figure out what works best to try and reduce flood risks or heat risks within the community. There have been things that we have done and implemented within the city to reduce flood risk. One good example, if you've ever been to the Margaritas restaurant in Nashua, you'll know that that's the Jackson Mills Dam there. And one of the things we did a few years ago is we actually essentially cut off the top of that dam in an effort to put inflatable crest gates on the top of it. And what those crest gates allow us to do is actually to lower when there's some sort of a flood event either approaching or is occurring, and we can actually now allow more water to pass through that area without being concerned about flooding upstream. And when we did this, we were actually able to remove a substantial number of properties from the floodplain. And what it did was it ensured that we were able to keep this really critical renewable energy asset online within the city. So we're trying to really do, again, those co-benefits, try and reduce flood risk, but also ensure that we have a renewable energy asset there within the city. Another thing, and this has not been done yet in the city, but it's certainly something that we've been looking at and interested in doing with some of our community nonprofit partners, is a concept called resilience hubs. And the idea here is to implement activities and facilities that can work to support the community during, let's just say, an extreme heat event, with battery charging, air conditioning, other types of services. So that way those that are at risk within the community can go to these locations with their other community members and get the services that they need during these extreme heat events or major storms where there's power outages, those types of things. So this is something that we've been working towards, and the idea here would be to use things like solar plus storage, so battery storage, to keep these facilities online and up and running, regardless of whether the power grid is up at all. And it all comes back to really this fundamental problem. Across the city, our challenge is that we're not all vulnerable to the same level. The downtown area, there are certainly areas along the river, the Nashua River, that are more vulnerable than others. But then when we look at the demographics within those communities, we know that there are populations that are more at risk for the types of impacts related to disasters. And we need to focus all of our planning efforts for extreme heat events, major storms, and all the services that come along with it to ensure that those populations are served first. It's really essential for us in an emergency management lens to think about how we can provide services to those areas within the downtown or along the riverfront to make sure that they are getting the services that they need. Certainly, you can reach out to me with any questions via email or phone. If you have any questions about what we're doing related to emergency management and climate change here within the city of Nashua. Thank you.
Thank you for inviting me to participate today to discuss climate change, air pollution, and health. I'm an allergy, immunology, and pulmonary medicine physician and an adjunct professor at UNH. So we're going to look at what the data shows from a clinician's perspective. The Department of Defense had a review in 2010 on climate change, and this is what they said. Climate change will contribute to food and water scarcity, will increase the spread of disease, and may spur or exacerbate mass migration. But what is climate change? It's not just global warming. It's the destabilization of the Earth's climate due to altered composition of the atmosphere. In other words, increased concentration of greenhouse gases such as carbon dioxide and methane. And greenhouse gases trap solar radiation, leading to global warming. So the basic aspects of climate change are that greenhouse gases concentration are increasing. Greenhouse gas affects climate system. World average temperature is rising relatively fast over the past 30 to 40 years. Sea level is rising. Many temperature-sensitive systems, including agriculture and farming, have changed over the past 2 decades, secondary to climate change. And an additional change of severe degrees in centigrade within coming century will disrupt the foundations of life on Earth. So the key determinants of greenhouse gases are energy production, energy consumption and efficiency, transportation, agriculture and food production, and waste management. So the environmental factors that are linked with climate change include extreme summer events and extreme winter events, all of which we have in New Hampshire, air pollution, forest fires, thunderstorms and floods, allergens, and dampness and mold. And I'm going to concentrate on air pollution and the allergens. So this is a complicated cartoon looking at the effect of greenhouse gases and climate change on the effect of health system and the causes, including even social mediated factors. I'm going to concentrate on cardiovascular and the respiratory diseases, but you can see that there is a complicated interaction that affects other aspects of our health. So the disease of interest that we're going to concentrate on include asthma, allergies and rhinitis, COPD, respiratory infections, and cardiovascular diseases. So there are direct effects, indirect effects, and social dynamics that all play a role in the health impact. The direct effects are things such as storms, droughts, floods, and heat waves. The indirect effects that I'm going to concentrate on are going to be air pollution. And you can see that there is definitely some social dynamics that are quite intricate that interacts with the health effect as well. And we'll be looking at things such as cardiovascular disease, respiratory diseases, and allergies, but mental health, undernutrition, and other causes of health impact are represented in this slide. So the areas of concern to us in the United States include cardiorespiratory health, heat waves, increased pollution, and asthma and allergies. So some of the issues that deal with respiratory health and climate change include biomass burning, windblown dust, and biofuels emissions. So biomass burning includes the burning of wood. New Hampshire has the second highest pollution from wood stoves, second only to Maine. We're not really affected as much by the droughts from Western US, although forest fires do have a large plume of smoke that is affecting areas way beyond California. The biotic system includes long and warmer growing seasons, enhanced pollen production, and specifically we know that CO2 levels being high increase the ragweed pollen, not only the intensity of the pollen, but also the duration of the ragweed season. So I'll first start with air pollution. So epidemiological studies have tended to characterize the effect of air pollution on health into short-term and long-term effects. So short-term effects of air pollution on health in this study, which was in a European study, shows an increase in PM10. Now that's particulate matter 10 microns per cubic meter. And this slide shows that cardiovascular disease and respiratory disease all have an increased percentage of health effects from the air pollution. Another short-term effects study was done by the National Mortality and Morbidity in Air Pollution Study and was reported in the New England Journal of Medicine. And this shows that there is an increased mortality in all natural causes, but also a significant increased mortality in cardiorespiratory causes, again from PM10. In this study that was published in the American Journal of Respiratory and Critical Care Medicine of the American Thoracic Society, showed an increase in admissions for diseases such as asthma, COPD and asthma, and all respiratory conditions in 65 and older, with a PM of 10 and also with black smoke. The long-term effects of air pollution on health, there are 4 studies here showing the association between air pollution and mortality in 6 US cities that was published in the New England Journal of Medicine. A study from the American Review of Respiratory and Critical Care Medicine showed particulate air pollution as a predictor of mortality in adults, and lung cancer, cardiopulmonary mortality, and long-term exposure to fine particulate air pollution, which is PM less than 10 and greater than 2.5 microns, was published in JAMA. And then many studies have been shown to show an association between mortality and also morbidity with exposure to traffic-related air pollution, not just this study in Lancet. The American Cancer Society showed a health impact of pollution as cause of mortality, especially in lung cancer, but also with cardiopulmonary causes. And the Stockholm study showed a myocardial infarction mortality was associated with long-term average air pollution exposure, such as from diesel fuels and overall air pollution of PM10 and PM2.5. The German study showed cardiopulmonary mortality was associated with living within a 50-meter radius of major highways, again, showing the effect of diesel fuel and pollution on health. So in this cartoon, we're looking at air emissions. In the middle part of the cartoon, looking at ozone, PM10, PM2.5, nitrous oxide, sulfuric acid, and benzene on the exposures in outdoor air quality leading to cardiorespiratory disease, lung cancer, acute respiratory infections, and cardiovascular diseases, including strokes and heart attacks. So this slide shows what happens to asthmatics. It shows an increase in hospitalizations with asthma, literally right after the point of exposure to air pollution, actually lasting for 6 days after the exposure before coming back to baseline. This is a study from the Annals of the American Thoracic Society from 2018, looking in New Hampshire at the annual mortality and morbidity and impact days associated with exposures to ozone and PM2.5. And you can see that Rockingham County and Hillsborough County, which has a high population and has more concentration of population in cities, has a higher impact days and also higher mortality and morbidity. So this is a map of the United States showing the annual excess morbidity and mortality from air pollution. You can see in New Hampshire, their annual excess mortality is 15, but you can see in states such as Pennsylvania, Texas, and California, which have much higher population and city densities, there's a much higher cause of mortality and morbidity from air pollution. So what have we learned? Well, the epidemiological observed association between premature death and long-term residence in areas with high air pollution concentration is robust. The deaths are largely due to cardiopulmonary causes. Similar associations have been observed with asthma exacerbations and exacerbations of other respiratory diseases such as COPD. And in many locations, the prevalence of asthma and allergies are rising. And we'll go into that in future slides. Also, the proximity to highways and busy roads with high density of diesel vehicle exposure increases the risk of negative health effects. So now I'm going to discuss the climate effect on allergens. So this is a slide from the Boston area looking at the ragweed pollen associated with different locales, including the city, suburbs, and rural areas. Now, cities are heat islands and increased CO2 and ozone, and you can see that there's a much higher incidence of ragweed concentration and pollinization in those areas compared to the rural areas. This is a slide showing the effect of pollen concentration, namely ragweed pollen, with the exposures to increase in carbon dioxide. And there's a significant increase in the pollen exposure, pollen count, and also the longevity of the pollen season. Quest Diagnostics is the largest laboratory diagnostic laboratory in the United States. And they did a study looking at overall allergy sensitization rates, and they looked at total IgE, which is an allergy antibody associated with allergies, and showed over 4 years an increase in allergy sensitization. They delved down deeper into what was actually causing the increase in allergy sensitization. They found that ragweed and mold were two of the ones that were increasing over the 4-year period. So we know that mold has a role in the development of wheezing and asthma and rhinitis in children, at least from the ages of birth through age 13. Elevated total indoor mold in infant bedrooms were associated with increased odds of wheezing from birth to age 13. There was an increased levels of indoor mold predicting an increase of asthma development, and high concentrations of outdoor mold and bedroom floor mold and yeast predicted increased risk of allergic rhinitis development. This shows you an increase in our asthma prevalence over 3 decades. There's been a steady increase, which is associated also with the same increase in effect from climate change. And if you look at the right upper, there's a more current asthma prevalence also showing an increase in 2001 to 2009. This was a slide from the CDC showing percentage of persons who experienced an asthma episode within a 12-month period. And it shows an increase in all ages, but under 15, there was more of an increase. And over 15, there was a higher increase in girls and women. But in all ages, there was a significant increase in asthma episodes. So surveys were done on asthma prevalence by the National Health Interview Survey, also National Ambulatory Medical Care Survey, the National Hospital Discharge Survey, and mortality component of the National Vital Statistics System. And in this cartoon, you'll see that the asthma prevalence remains very high. The female versus male, other versus white, black versus white, and under 18 and greater than 18. And you will see that there's a very high incidence of outpatient physician office visits, emergency department visits, and hospitalizations, and even death. And there's obviously a larger effect on the Black population, as seen in the middle of the slide, period. But all populations were affected and have an increased incident. So in summary, we find that there's a higher population of patients that are affected by climate change when there's a higher pollen count. And this is associated with increased allergic sensitivity, increased healthcare utilization, increased allergy of over-the-counter medication use, increased emergency department and physician office visits, and reduced lung function and increased pulmonary inflammation in asthmatics. There's also an increase in cardiovascular and respiratory mortality. And more importantly, there is an adverse synergistic effect with increases both in air pollution and pollen on asthma and allergies. As a practicing clinician in allergy, immunology, and pulmonary medicine, my patients are most vulnerable to the health effects of climate change. It will need public awareness, industry innovation, medical community leadership, and elected officials to work together to effect solutions to the health effects of climate change. Thank you.
Thank you very much. My name is Andrew Preventure. I'm a principal at Be Fresh Consulting. I've been tasked with helping to put together this ad hoc commission while working with a coalition of organizations. We appreciate everyone so much for joining us tonight, and we appreciate all of our attendees who are on as well. Just a couple quick reminders. The first is that this is being recorded along with the chat and any Q&A that will be popping up in the bottom of the screen. If any attendees have an interest in asking a question, feel free to use the Q&A portion there. Also would like to let everyone know that folks have been started out on mute. If you are looking to speak tonight as a commission member, just feel free to unmute yourself and you'll be able to say whatever you'd like. One of my jobs tonight is to hopefully try to keep time. We appreciate everyone's ability to be on here, and we appreciate your time immensely. We had told everyone that we'll be on until 8 p.m. tonight, and we're going to do our best to try to keep to that time frame. Additionally, we want to thank Semra, Justin, Mark for their video presentations, and also thank Sherry from DES, who put together some additional slides that were in the box packet for everyone. To start off today, we want to remind folks that this is an ad hoc commission in nature, but we're going to do our best to follow as many norms as we can, in particular with the fact that we do have some elected officials who've been willing to be on this commission. Speaking of elected officials, we'd like to give a sincere thanks to Senator Tom Sherman and Senator Jeb Bradley, who both helped spearhead SB 590, which was the impetus of the commission we have here today. This is kind of a different way of going about a commission in the world we're in and with the legislative priorities as they were put. So we're very excited and thankful for everyone for being willing to take part in this here today. The first thing we're going to do is a quick roll call. I'm going to name a commissioner's name and the association or organization that they're representing. Feel free, if you'd like to say a quick introduction, you're more than welcome to. We are definitely in a tight time frame, and there will be some opportunities, hopefully, in our next meeting to do an additional prolonged introduction period. So I will start it off with Jim O'Brien with the Nature Conservancy, and representing Jim here tonight is Sheila Vargas.
Hi, everyone. Just here in lieu of Jim, and thank you for putting up with all of my text messages, and clearly I need some more space on my Mac.
Next, we have Joanne Eschheim from the New Hampshire Public Health Association.
Hey, everybody. Nice to see you.
Cliff Bello from the New Hampshire Municipal Association.
Hi, Clifton B. Law. I'm Assistant Mayor for the City of Lebanon.
Thank you. Dan Bennett, New Hampshire Auto Dealers.
Good evening, everyone.
Catherine Bork, Unitil.
Hi, everybody.
Senator Jeb Bradley.
Hi there.
Zach Conway from Dartmouth Hitchcock. Today he will be represented by Courtney Tanner of Dartmouth Hitchcock. I believe Courtney was on. Let me see if I can. Hi, Courtney, you there? All right, we'll come back. Next, we have Representative Dave Danielson. Is Dave on? Do not see him. Representative Danielson, if you are in the attendee section, feel free to click the raise hand button and we'll be able to move you up to a panelist. Michael Dow, New Hampshire Medical Society.
Hi there. Glad to be on the panel. I'm a radiologist from New Hampshire.
Wonderful. Michael Fitzgerald, Department of Environmental Services. Oh, Mike, I think you're on mute. Sorry about that.
There we go. I do my best work on mute. Good evening, everyone.
We have Donna Gamache from Eversource was not able to attend today, but will be viewing the recording. George Hansel from the Governor's Millennial Council and Mayor of Keene. He will not be in attendance tonight, but has an alternate of Mary Bruner.
Hi, everyone. Mary Bruner. I'm here on behalf of Mayor Hansel. I'm a planner with the City of Keene.
Tom Irwin, Conservation Law Foundation. Today we'll have an alternate of Nick Krakoff.
Yeah, hi, everybody. Nick Krakoff from Conservation Law Foundation, standing on behalf of Tom Irwin today.
Chris Kelly, NAACP of Greater Manchester.
Hey, everyone. Happy to be a part of the commission. I'm really looking forward to doing some great work.
Michael Licata, New Hampshire Electric Co-op.
Hello, everyone. Happy to be here.
Matthew Mayu from the Office of Strategic Initiatives will be absent today, but he did want to let everyone know that they'll be viewing the recordings, and he's looking forward to contributing. Representative Kat McGee.
Looking forward to it.
Madeline Minot, Clean Energy New Hampshire.
Hello, good evening, everybody.
Paula Minahan, New Hampshire Hospital Association.
Good evening, everyone. And Courtney is on. I think she just was unable to be unmuted, but she is available.
Wonderful. I will mark her down.
Hi, Andy. Thank you. I just heard that I'm unmuted. Courtney Tanner, present.
Wonderful. Thank you. Huck Montgomery, Liberty Utilities. Didn't see Huck on. If Huck, you do come on, let us know. Or if you are stuck in the attendee area, if you click the raise hand button, we'll make sure to elevate you. Next, we have Michelle Roberge from the Department of Health and Human Services.
Hi, everyone. Nice to see you. I'm with DHHS and the Division of Public Health Services.
Next, we have Dennis Sassaville from Worthen Industries.
To participate.
Senator Thomas Sherman.
I'm here. Thank you.
Roger Stevenson, Union of Concerned Scientists.
Present.
Colleen Vane, Timberland.
Be a part of the commission.
Cameron Wake, University of New Hampshire.
Present and wonderful to be part of this illustrious group.
Senator David Waters.
Good evening, everyone.
Rob Warner from the League of Conservation Voters was on earlier and has to attend to something, so he has stepped off, but he will be watching the recording. And last and certainly not least, Representative Gary Woods.
Good evening. Glad to be aboard.
Wonderful. Thank you, Representative. To get us kind of officially moving a little bit, we are in oh, David Trier, sorry about that. Did I miss you?
So I'm also here if anyone cares.
We do. From the BIA. Wonderful. We have anyone else that we might have missed? Apologize for that, David. starting off here, although we are an ad hoc commission, we are going to do our best, as we said, to kind of follow as many norms as we can. One of those norms that we think that is pretty important is electing a chairperson for this meeting. I believe that Senator Bradley has a nomination to bring forward, so I will send over to Senator Bradley.
Yeah, good evening, everybody. Again, I'm not sure why I'm not visual. It's probably a good thing, but start my video. Well, what about that? I'll start my video, then I'll have my nomination. And I thought that because it was Tom's bill, he was the prime sponsor, Senator Sherman would make a good chair of this commission. And I have to let my dog in the house.
Senator Bradley had put forward Senator Sherman as a chairperson for this commission. Is there a second for Senator Sherman?
I'll second that.
Wonderful. Representative Woods has seconded. We will go through a quick roll call, and if you are in agreement of Senator Tom Sherman serve as chairperson of the commission, just say yes for me. So we'll start off with Sheila Vargas.
Yes.
Joanne Ashheim.
Yes.
Cliff Bellow.
Below. Yes.
Dan Bennett.
Yes.
Catherine Bork.
Yes.
Senator Bradley.
Yep.
Marky Tanner.
Yes.
Thank you. David Creer.
Yes.
Michael Dow.
Yes.
Mike Fitzgerald.
Yes.
Mary Bruner.
Yes.
Nick Krakoff.
Yes.
Chris Kelly.
Yes.
Michael Licata.
Yes.
Representative McGee.
Yes.
Madeline Minot.
Yes.
Paula Minahan.
Yes.
I believe Hunk Montgomery has joined. Huck, the motion going forward right now is for Senator Tom Sherman to chair this commission. Huck, can you hear us all right? We'll come back to Huck. Michelle Roberge.
Yes.
Dennis Sasseville.
Yes.
Senator Sherman.
Yes, thank you.
Roger Stevenson.
Yes.
Colleen Bain.
Yes.
Cameron Wake.
Yes.
David Waters.
Yes.
And Representative Woods.
Yes.
Wonderful. I will pass over, it's a unanimous decision. I'll pass over these duties to Senator Sherman. Senator Sherman, next on the agenda, we have hopefully some sort of approval of a public comment process. And then we would move on to discussions on the presentations, including question and answer. All of the presenters, the video presenters, are on this call now and are willing to take any questions that the commission members might have, but I'll pass it over to you. Thank you.
Thank you. If you all have the agenda, you'll see just underneath the agenda is the public comment proposal. It's brief, so I'll read through it quickly in case you don't have it. The public comment proposal is a 15-minute period at the conclusion of each meeting. Public comment will be limited to 2 minutes per speaker. And I assume Andrew will be the timekeeper. I'm sorry, actually, moderator and chair will keep and enforce time. I think the moderator is a wise choice there. Comments and questions should be germane to the meeting's topic and presentations. Written comments can be electronically submitted via the website through the entirety of the commission process. Submitted comments will be made available to commission members and will also be publicly available online via the website, provided they are not vulgar, obscene, or profane. Comments may also be submitted in the mail, and that's to Be Fresh Consulting, Emission Commission, public comment, and then the address. I would just underscore that we are working hard to be constructive and to get some solutions and to be moving forward. So I would hope that we would move forward in the spirit of positivity rather than accepting any comments either by commission members or the public that would not be constructive. Andrew?
I have a question.
Yeah, questions?
Yeah, it refers to a website, but there isn't a website referenced here, so I was just wondering where the website is.
It's nhemissionscommission.com.
Okay.
Are there any other questions?
Senator Sherman, Mike Fitzgerald from DES.
Sure.
Just want to take the opportunity to note that any information that is presented or shared with the commission with state agencies would be subject to 91A, RSA 91A, which controls state government open information requirements. So anyone commenting should know that if they provide it to the commission, there are state agencies involved and everything. I assume they'll all be public anyway, but they would be subject to a 91A request.
That's very helpful. Thank you.
I also would like to note that we do a lot of public hearings here. 2 minutes is very short. I'm not certainly not a fan of trying to extend these meetings long, but we generally will go 3 minutes and if there aren't many people, 4 or 5, but 2 minutes is a pretty brief period, but
would you
leave that open.
Mike, would you be amenable to saying public comment may be limited as opposed to will be? That way there is some flexibility that it's up to the moderator?
Absolutely. That's the way we usually handle it. If there's not a lot of people waiting, we try to be more open and flexible, and also depending on how germane the comment is. So,
is there anyone who has any other comments about the public comment line? I think it reads public comment will be limited to 2 minutes per speaker, and I'm suggesting we might say public comment may be limited to 2 minutes per speaker. And I don't know if that needs to be modified further, but that would, the second part of that is that the moderator and chair will keep an enforced time. We could add if necessary, just so it doesn't sound quite so onerous. Is there any other modification from the commission?
Hi everyone, this is Sheila from the Nature Conservancy. I don't have a modification, but I just do have a point to make around the public comments. There actually is a page on the website where individuals can submit public comments before and after, and so those public comments will be compiled and presented to the commission members as well.
I would also suggest that we capture the chat for the public chat for display. We did that in the select committee on elections, and it was incredibly helpful because there were a lot of very important comments in the chat. So just while I'm thinking of it, I thought we might note that. Andrew, if you could.
Absolutely do that.
With the only change being public comment may be limited to 2 minutes per speaker, that gives us lots of flexibility. Moderator and chair will keep and enforce time if needed or as necessary. Do we have a motion to accept the public comment proposal?
I'll move that, Tom.
Okay, a second?
Second it.
Okay. Andrew, did you get, it was Senator Bradley?
And Representative McGee.
Right. Any other comments or discussion?
So, Senator, this is Roger Stevenson. Is the comment by chat or by Q&A explicit in that? And will that be introduced as a method of making comment before each meeting begins?
We could put that in under the section, written comments can be electronically submitted. I don't know if a little subparagraph there that would say submitted comments and chat from each meeting will be made available. Does that make sense? Roger, do you think that's a good place for it, or do you have a suggestion?
No, I think that's fine. I think that allows people to, that gives people an understanding that they can use that as a channel.
Okay. Any other comments about comments? So the second change would be, Andrew, did you catch that? I think it would be the subparagraph.
Submitted comments and chat will be available to commission.
Right.
Yes.
Okay. Do we have to do, this is not a typical legislative event where we have to have a roll call. I would prefer to use, if there are any objections, that we go ahead and accept this. Unless there's a feeling that we need to do a roll call for every vote.
I think, Tom, this is Jeb. That makes a lot of sense. We don't need a roll call.
Okay. So are there any objections to this? If not, we will go ahead and accept the public comment proposal. Great.
Great, I'll make those edits.
Thank you, Andrew. I don't think we have anything else, do we, at this point, Andrew?
No, we're good for a question and answer and discussion on the presentations.
So let's go on to the discussion on presentations. Should we do it by each presentation? We could do it in order.
Sure, the first presentation was Semra's.
I'm sorry?
Semra was the first presentation, and I believe she is on.
Great, and thank you for that wonderful presentation, by the way. One of the things that I noticed from all three presentations is how much work is being done right here in New Hampshire on this issue, which, and I know Cameron is a part of the commission, and he is a wonderful, I hate to call you a font of knowledge, Cameron, but you are. Can we, are there any questions?
I have a question, Tom. Senator Waters, if you can hear me.
Sure. Go ahead.
Yeah. Well, thanks to everybody. Great presentations. And I'll just make one or two comments and a question for both Sheila and Kate too as well. You know, when we did the legislation, I did note that there was something of a differentiation between saying emissions that cause climate change and then public health effects. And some of the emissions that are listed don't cause climate change. So we have a little bit of a disconnect there. And I think it also suggests that as we have our discussions and ask our experts for more information, that we probably are going to need to differentiate in what kind of recommendations we make, perhaps by class of emissions, because that has a lot to do with what is practical or not practical at reaching certain levels. So my question first to Sheila, because she had the maps of the Hampton Seabrook area. I was in a seminar today for National Caucus of Environmental Legislators, and Minnesota, for example, has authorized that there'll be a census tract by census tract creation of information that not only does what we saw in your presentation for Nashua, but layers onto that sources of emissions and presence of pollutants and so forth. So I really wondered what the state of that kind of work for New Hampshire is, and you know, whether that is something that you could comment on. How much do we have that not only shows like for floods or that kind of those that medium risk, but the other kind of related things about exposure to those emissions, and or is that something that we might need to recommend as a commission, that kind of research needs to be done statewide?
Want me to comment on that? Or I know Justin from Nashua also had a lot of work that he showed in relation to that. But I'll just say from my perspective that I think more research could be done. I think what we have right now is what I think of as the backbone. So we have all of that social vulnerability work that has been done at the census tract level. We have supplemented that now with newer data that has become publicly available, in part due to the pandemic, that adds additional risk and resilience factors to that. But to the best of my knowledge, they're not specific to emissions, for example, or to the kinds of things that might be most pertinent to this panel. So I think it's sort of like, the way I think of it is a Christmas tree. We have like the Christmas tree, and we can hang different ornaments on it. And if we can get that data, probably through New Hampshire DHHS or Wisdom, one of the portals, or there might be some primary data collection involved, we now have fairly easy ways to hang those ornaments onto the Christmas tree and make them visual, spatially explicit in the way that both Justin and I, for example, showed, and Dr. Wint showed as well. So it's just a matter, I think, of making sure the data that's most relevant to you can be released at the level that it would be meaningful.
Thank you, Semra. Thank you.
Sure.
Do you think it'd be useful, just following up on what you just said, to perhaps have Katie come in, and I think it'd be most helpful to ask the question, but would she be able to answer some of these issues, Katie Bush?
Yeah, I think she would be a great person to invite. And I think she also, there are some privacy and legal concerns in terms of what DHHS is able to give even to researchers like me, for example, and she or people she works with could probably speak to those issues and let us know what might be feasible to address the kinds of needs that this panel might have. Great.
David, you had a second part to your question, or did that answer it?
I think that got added. I did want to emphasize sources of emissions, because the work from Minnesota does get down to the level of each chemical plant, each gas station, you name it. So, or polluted area. So that's just, having seen that, I thought it was particularly useful for our getting down to what we're thinking about, and especially the kind of social justice and equity impacts that reveals.
Yeah. That would be, I agree, a really important thing to do.
Sounds good. Are there other questions for the panelists?
Senator Sherman,
Yeah.
This is Michelle. I can, if you want to set aside some time, I can work with Katie and see if she's willing to come and present, if we know kind of what information you'd like for her to provide. I'm happy to coordinate that with her.
Yeah, I think you said that beautifully, Michelle, because we want to be very specific in the questions that we want answered, and I think that would be a very useful discussion. And what David Senator Waters was talking about, which is, this is a broad topic. We're focusing on emissions, but we're focusing on climate change, public health, and health outcomes, and then the overlap between the two. And so I don't know if anybody has thoughts on what would be the most important questions that we need answered in terms of this commission and that focus.
Well, I'll chime in again, Tom, if you don't mind.
Sure, please.
That, it's going to be hard for us to make any recommendations if we don't know the amounts that are being emitted now. And so if we have that list of, primarily climate change causing, but things like mercury, no. But, what statistics we can have on how much what quantities are being emitted now in the state, so that if we are setting various targets for 2050 and intermediary ones, we can have a sense of what the baseline is.
Yeah. I'm sorry. Yes.
I'm sorry, I didn't mean to interrupt you.
No, please jump in, Mike.
Yeah, I just wanted to note that DES and our staff here, specifically Chris Skoglund, whom many of you may know, will be assisting me and providing support for any work that we do on this effort. But Chris has been keeping an inventory of greenhouse gases for New Hampshire for several years. We share that information with all of our New England partners and through an organization called NEGECP, New England Governors and Eastern Canadian Premiers. We share an inventory with the entire region of 5 Eastern Canadian provinces and the New England states. And I have asked Chris to listen in on these meetings, and if necessary in the future, if you would like to have us provide an overview of the status of New Hampshire emissions in all sectors, we would be, and that's the royal we, Chris would be quite happy to provide that information and do a presentation for you, for the commission.
I think that would be a really wonderful starting point. Maybe, and I don't know how the commission feels about this, but maybe we could get a baseline inventory of what we're looking at as a state across emissions, and then also think about getting a baseline inventory across the state in terms of health impacts. And Michelle, I don't know who would be best to do that and the best vehicle, but this is very reminiscent of another commission that Senator Bradley and I serve on, the environmentally triggered disease. But what's different is this is very much focused on emissions and has a different skill set because of all the different people who are represented here. But maybe starting with where are we right now? So the DES inventory, and I don't know, Mike, if that also includes what we're breathing from other states. You know, I remember back to acid rain and how that was not endogenous. It was coming from other places, perhaps from the north and the west. And I'm wondering if perhaps do we differentiate between endogenous and exogenous emission or exposure?
Again, most of the emissions for New Hampshire are not based on measurements, but are based on emission factors that are associated with population.
Right.
But we do a lot of work using a greenhouse gas emission inventory tool developed by EPA. I also want to note that, again, Chris was very instrumental in the 2009 Climate Change Commission that developed emission goals. And so we could provide some information on the climate change report that was produced by that commission and the recommendations for emission goals there, the breakdown of emissions, and how we compare to our neighbors. But primarily we look at the emissions that are associated with our state. Just to give a quick example, electricity emissions. For instance, we may have power plants that are supplying power to the greater Boston metro region here in New Hampshire. A large percentage of our power, a significant percentage, is exported. But those emissions are associated with New Hampshire, but they're really due to consumption that occurs in Massachusetts and Connecticut and so on. So I think we can put together some information that would provide a pretty good perspective on what the first Climate Change Commission did, the goals and how they arrived at that, and second, what our emission status is now, and put it in context.
That sounds great. I'm wondering if, and I'd love to get some feedback from the presenters and also from the commission, if we thought of this in a sort of a large 3-point, in terms of where we're starting from. One is going to be the emissions and that part of the environment that Mike's talking about with Chris presenting. Another would be what Michelle was talking about, which is sort of a, where are we in the healthcare arena, and what have we seen over the years in New Hampshire? I know we had an overview of that, but perhaps having Katie come and giving us a little more detail about what we were hearing about allergy, pulmonary, and cardiovascular disease. And then the final one would be on the impact on climate change that we're seeing. And unless I'm missing something, I think those were the big 3 targets of this commission, and how they interact. So that the goal would be, where do we set the emissions standards and emissions goals to mitigate the other 2, which would be health impact and climate change, climate issues. Michelle, go ahead. Yeah.
Yeah, I certainly will pass this along to Katie, and we can put together, a presentation of the information that we have that's certainly available. I know that the Wisdom portal, which somebody mentioned earlier, is data that is accessible. Currently, it's on a website. So certainly Dr. Bush can talk to the data. I'm not sure that we have information that's on that fully answers all the questions that were brought up, but we can certainly share the information that we do have. And I'm happy to talk with Dr. Bush and kind of try to pull together something. I don't know when you want to schedule that, if you're thinking for the next meeting, but we could put some target dates out there.
I'm just thinking sort of what are the trends and where are we now is on those 3. I may have missed one, but there was allergy, there was pulmonary, and there was cardiovascular were the 3 that I took away from the presentation.
And I know we also have some climate on the Wisdom portal. We have some other data around tick-borne disease and
right.
And heat impacts. So
right.
That might be relevant, or folks might be interested in that. I'm just not sure on all of these, and I will need to just refer back to Dr. Bush on what's available, what we can provide.
That would be great. And Mike, if you and Chris could come up with something that painted that picture from the emission standpoint and what has been done to date, so we don't reinvent the wheel. Yep. And Dr. Wade, I don't know if you or Sheila or who would be best to help us. We had a lot of it tonight, I think, with the presentations, but do people feel that it would be helpful to spend a session talking about where we are right now on each of these 3, or if there's more than the 3?
I'll just jump in here.
Yeah. Go ahead.
So I'm happy to update some of the work that Semra showed tonight on sort of how our climate has changed and how it might change. We have some results from the latest National Climate Assessment. But I'll also say that the story is no different. It's going to get warmer and wetter, and we're seeing the trends already, and we're going to have more floods, and sea levels are rising. So it's pretty consistent. I did just want to mention that I'd really encourage the Commission not to expect that we're going to get definitive answers on those questions to make decisions on emissions reduction. It's pretty hard to tease apart, how many tick infections are due to climate change versus how many we would have had without climate change. It's pretty hard to track the number of foodborne illnesses, or how many people went to the hospital for asthma? I mean, these are really complicated, difficult questions. I think it's great to get a sense of where the trends are and where we might be going. But when Semra and I worked on that report, we looked into this and realized it would be really difficult to get the definitive data. So I just want to caution us, we can get some additional information, but it's not going to answer all of our questions. And I don't think we have to wait for that to address the challenge. The other piece I'd just like to throw in here is that traditionally, when we did our initial climate action plan in 2009, and the emissions inventory that Mike is talking about, is very much focused on the energy that we use in the state of New Hampshire. But there's a whole other piece to our emissions that we tend not to account for, and that is for all the goods that we consume. So if we buy a car in New Hampshire and use that car, we account for the gasoline we burn, but we don't account for all the energy that went into actually producing that car and shipping that car. And if you think about how much we consume, actually a consumption-based emissions perspective tends to show that wealthy Western countries have far more emissions than places like China. So that might be a bridge too far for us to take on. But I do want the Commission to understand that there are very different ways to think about emission standards, and consumption is becoming one of the factors that is included in those states and entities that are actually looking beyond just the energy that we use to the lifestyles that we have.
And I would like to add something to that as well, Senator, if I could. And that is that as we keep revisiting this, because it's such a complex issue that it's really difficult to get a handle on, as Mr. Wake was just alluding to, we also have the sort of compound problem of the fact that as we're warming, we're creating a positive feedback loop in that our consumption goes up to keep us cool. So I think the economy plays into this. In other words, there are many economic reasons or economic impacts that we will be facing, both on the health side as well as on emergency management and mitigation, right? All of those seem to be the less tangible pieces that we have a really hard time addressing, but they are there and they are looming, and I believe that those will be significant as well. And so I think it's to go back to your original question, Senator Sherman, yes, I think we should start with a benchmark. I think it's appropriate for us to see what's been done before and then figure out where we are now. And it might even give us some indication of what we've done in the last decade, right? If that was a 2009 report. So I think that's a really good place to start. But I think we also have to understand that this is sort of an escalating issue. And so that's part of the reason why people keep trying to take a stab at it, is because it will cause us to increase our consumption in order to try and beat the heat or whatever other implications are coming our way. So I just feel like although those things are very difficult to get a handle on, we should try and look at the economic impact of allowing the rising to continue to happen without any addressing or abating. I think there's a way to do that, but.
Yeah, that's a great point. I also am, I think one of the really strong points of this commission is that we have representatives of the automobile industry and the BIA. And, when we talk about costs, there are short-term costs, long-term benefits, and I would hope they would help us with their resources to look at what will be the impacts of any potential emissions targets on their industries. And the one other thing that I hadn't thought of, but you tweaked a few brain cells that are still functioning, and is not reinventing the wheel. What have other states experienced? So in states that have set aggressive emissions goals, has there been a cost to that? Have they already seen a benefit, or are they still waiting? And, there are projections, especially in pulmonary disease and I include in that asthma, of the impact of decreasing particulate matter in the atmosphere, and costs have been attached to those models. So, in other words, reducing emissions, reducing particulate matter has a true cost benefit in terms of healthcare, but there's also likely a business cost to doing so. And so I don't want to get lost in trying to do too much, but I think it's important to have a broad perspective as we move forward. So perhaps hearing from, and Andrew, you might be able to help us with this, hearing about what other states are doing, what's working, what's not, might be a helpful perspective.
Absolutely.
Senator, this is Roger. I've offered Miles Hagney, a Stanford student who is our Schneider fellow, clean energy fellow this summer, to do some of that research, and he'll be providing Andrew and Sheila with an annotated bibliography that will include examples of states that have set greenhouse gas emissions reduction goals, and how they went about it.
That's great.
I may add, Tom, on your list of the areas of health. I'm not sure whether I really heard an inclusion there. If we get some baseline on the presence of some of the vector-borne, and also, I mean, for us in the Seacoast area, we're going to see HABs increase dramatically in the Great Bay and in the harbor, and that's going to have serious public health implications. But I think we could have statistics now on Vibrio in seafood. We could have statistics now on West Nile, on Triple E, and certainly on Lyme disease. I think it's just worth our also understanding the where we are on environmental impacts of vector-borne disease of winter ticks for the moose population, because it's biodiversity is a real issue, and that has these are kind of effects that we are already seeing pretty dramatically in the state. And I don't think just because they're not human should be excluded in that. So I just wanted to make sure we had those kinds of vector-borne and in particular seacoast issues, something that we can get some more information on. I know Semra alluded to it. There's good research out of UNH on some of these, and that would be helpful to the group, I think.
I was going.
Time check as well too, just so we do have an opportunity for the
Andrew,
public.
can I talk? Can I chip in here a little bit?
Who's that?
That's Mark Wynn.
Oh yeah, absolutely, Mark. Thank you.
Tom, how are you?
Good.
And hello to a lot of my old friends that are on this. Good to see you all. I just wanted to say that there is a lot of information already available. A lot of this has been done through the American Thoracic Society, and a lot of other organizations like the American Lung Association has done a lot of this research. The other thing I'd like to say, though, is that you can look at the state and look at some of the health effects at certain things such as hospital admissions for asthma, or hospital admissions for COPD, or hospital admissions for heart attacks. So those are hard numbers that you can actually have some data on to make some decisions on. But I agree with many of you who have spoken, Senator Waters, Cameron, talking about how difficult it is to actually convert that data into recommendations on emissions. But I think that awareness is part of the project that you're trying to do, which I applaud you all on. And I think that making the awareness of what the health effects that are happening in New Hampshire, not just in other parts of the world that does not apply to us, can have a very strong effect on decision making. So I would recommend that there can be these hard data that you can get that will help you to understand some of the effects of climate change. And to Senator Waters' comment is absolutely correct that the particulate matter and things like that, that's not what's causing climate change. That's an effect of climate change. Ozone and the ground ozone, for example. So I think that the effect of climate change and then the pollution that you're looking at as an effect of that makes it such more complicated than to really talk about emissions. You know, I always tell my patients that we're the tailpipe for the Midwest because of the jet stream coming in. So we get a lot of pollution that we haven't initiated, and that is still causing health problems in our state.
Right.
So you can look at the health problems and come up with a hard number as to how climate change is and pollution as a consequence is affecting the state of New Hampshire.
Right. Thank you, Mark. That's really great. And I know we are, since we've adopted public comment rules, just before we jump to the public comment, I wanted to know if Senator Bradley has put so much of his career into this issue. Did he have any thoughts on how to move forward other than what's already been said? He's still on, isn't he, Andrew?
Yeah, there you go.
And now I'm unmuted. No, I just said I'm glad to be here. Don't have anything else to add, but look forward to working with everybody.
All right, thanks. So,
Senator Sherman?
Sure, Mike, go ahead.
If I could just very quickly, I just want to remind everyone that Sherry Godlewski from DES put together some information. The technology did not allow for her to have a video presentation, but she put together a pretty good presentation, and I wanted to remind everyone to take a quick look at it. And thank Sherry for a lot of hard work under a very short time frame, a lot of pressure. So
that's great.
Just appreciate her efforts.
Andrew, is that on the website?
It is, yeah. On the we can all the presentations today will be uploaded to the website, and in the box under additional information is where all the commission members can currently view it.
Great.
Senator?
Yes.
This is Gary Woods. Here. If I could just add a couple of observations and additions to our thought process. Senator Waters mentioned the word just in passing in biodiversity, and I think that should be part of our language as well. We sort of mentioned that in passing in terms of the change in the tick-borne disease with the moose, and I think it is a term that we need to address and keep in the back of our mind as we go forward. Secondly is we're laying the groundwork for water as well. And my background is an image of the earth with all of the water on this planet, including the oceans. And that's the next big disaster, shall we say, is water. And climate change will definitely affect that. And we're seeing it now, a lot of wells going dry. So there's a domino effect, although we're talking about particles in the atmosphere. Biodiversity and water, I think, should be at least in the background of our consideration.
Great. Thank you, Gary. So Andrew, let's open up for public comment. Do you have anyone who has a question or a comment?
Yeah, the first question that was submitted is from Georgia Murray. She says mental health was also flagged as an important health impact by one of the speakers. Not sure if there's anyone of our speakers who would like to speak in particular to mental health effects.
Yeah, that was, I mentioned that, and thank you for noticing. This is a really, really important and sometimes overlooked aspect of the impacts of climate change. And I think also with our state's vulnerability from the opioid epidemic, these things often go hand in hand, issues with substance misuse and mental health. And again, there are twofold issues here. These are people who are often more vulnerable to the climate-related impacts, and also economically, folks who are impacted by these kinds of flood events we talked about may not then be able to get the treatment and support they need to maintain a positive mental health trajectory or remain on the path to an addiction are not going to be able to support themselves economically. So again, those compounded effects of health and economics and people's ability to participate in the workforce are really converging. So I think to the extent that we could keep mental health on the table, it's one of the most costly and long-lasting impacts associated with climate change.
You know, and I just wanted to jump in there because we saw the map of Seabrook with the impact of sea level rise or tidal movement on Seabrook, and for the last 3-4 years now, I've been working to try to bring services to Seabrook, but it's an interesting. Actually, it's not interesting. It is a perfect storm. Not only are they at risk from an environmental standpoint, from a socioeconomic standpoint, but they have 0 services. No addiction services, no mental health services, and they have to, and the nearest doorway is in Dover.
Yeah.
So when you think of the global health, and I know DHHS is on top of this, but when we think of global health and determinants of health, social determinants of health, I think they all come together.
Yeah.
And so I'm really thrilled that mental health is a part of the discussion.
Thank you. And I've used the same words, perfect storm, to describe that area. So thank you for acknowledging that.
Right. We are working on that, by the way. We are getting closer to providing a solution. So it's great.
Good to hear.
I just wanted to mention, Cameron, you had a question for Mike in the chat. Did you get that answered?
No, I didn't. I just wanted to ask Mike, and thanks for your presentation. I'm wondering if you have a sense for how many dollars you save for not for Mike. Oh, no, I'm sorry. For Mike, I was going to ask, can you just share the latest report that you've done for the New England Governors, Eastern Canadian Premiers on the website prior to Chris presenting?
I
think you're muted, Mike.
There we go. Can you hear me now?
Yeah.
Okay. Yeah, there's a draft report. I'm not sure if it's final and approved, but when it is, we can share that.
Okay, great. And did you have a follow-up, Cameron?
Well, I just wanted to ask Justin, if we have a couple of minutes, if he had a sense for every dollar that he spent on sort of building resilience in Nashua, how many dollars he saved. There's you know, a wide range of studies that show the payback is on the order of $5 to $6 at least, and maybe more. And I'm just wondering if we had some local data to support that.
Fortunately, we don't have any local data, and typically that's because we really don't have a good indication of the long-term impacts of those mitigation projects. So as an example, if we look at the Jackson Mill Crestgate project, it's only really been in service for a few years, so we don't have a real good estimate of the return on investment. But I think that the reports that were done by the National Institute of Building Sciences are probably the best that have been done on this topic. And what they typically do will break it down based on the hazards. So they'll look at flooding, they'll look at wind-related hazards, and show the impact of government mitigation funds and how they're beneficial instead of paying for the response or recovery after a disaster. So highly recommended for people who are looking at how we can better leverage mitigation dollars.
Great. Okay, let's jump back to the public.
Attendees can just raise their hand if they would like to be able to address a question. We don't currently have any hands up, but we will allow folks another opportunity to raise their hand or submit a question on the Q&A.
And just to remind people, Andrew, people can continue to comment. Can you give the way that they do so?
Yep, they can go to nhemissionscommission.com, and on the top right-hand corner on the drop-down menu, there's a public comment area where you'll be able to submit it. And you will also have an opportunity to submit in writing, and we'll have that address listed up on the website as well.
Okay. I think we're just about there at the 8 o'clock hour, unless there are any final points of wisdom.
Senator Sherman, the only other thing I would have mentioned is that the next meeting is scheduled for Thursday, September 3rd. And the topic of that one was emissions by sector. I know we have a number of other items that have been mentioned tonight, and we'll reach out to those folks and see if we can grab the presentations as well. I'd imagine that we will probably extend the beginning part to 6 o'clock again and use the full hour in order to present all the information that's been requested.
Great.
Yeah.
Thank you. I don't think we need to do a fancy adjournment, but does anybody object to adjourning right on time?
Well
Thank
done.
you all.
Thank you.
Thank you all very much.
Thanks, good night.
Thank you.